I just want to start by introducing myself. My name is Yogi Acharya. I'm an organizer with the Ontario Coalition Against Poverty. I want to welcome everyone who's shown up here, members of the media and the community. Some of us are healthcare workers, others of us are people who work in the community, and all of us respect the need for social distancing and physical isolation when necessary. But we feel compelled to call this press conference today because there are thousands of people in our city who are simply not afforded the chance to follow those basic public health measures to safeguard their lives and the lives of all of us in this city. And that's our starting point for this press conference today, is that this decades-long practice within our city of cramming growing numbers of homeless people into under-resourced, understaffed, and unsanitary homeless facilities is now a spectacular liability in the efforts to curb the spread of COVID-19. And there is a solution to this problem. We've seen dramatic measures being taken by governments on various fronts, and this is a crucial front where we need to see a similar ramping up of efforts to dramatically and rapidly increase shelter capacity, particularly the motels and hotel rooms that can be provided to provide space for physical isolation when necessary, and to allow for reduced overcrowding or reduced crowding in existing shelters, respites, and drop-ins to allow people for the chance for social distancing and physical isolation. Another critical point, which some of the speakers here will get into, is the necessity for opening additional drop-in spaces where people who can't get into the shelter system can go. Governments have also announced measures to assist people in some limited ways to deal with sudden unemployment rising from the closures that we've seen all across the city and this country. But a group of people who are the poorest in our country and in our province certainly are people on social assistance, and we haven't seen anything that could substantially impact their well-being in this time. So we're also calling for a boost in social assistance rates so that people can secure food and other basic necessities they need to survive in these times of pandemic. And as we say, hungry people cannot self-isolate. And finally, we also recognize that this pandemic is unfolding at a time of an escalating overdose and opioid overdose crisis that is claiming thousands of lives across this country. And the combined effect of those two crises for people, coupled with the service reductions that we've seen in the overdose prevention sites, is proving catastrophic for many people, and we fear worse is to come. And we have some recommendations that governments can implement today to help tackle that situation. So the speakers that I will introduce now will speak to each of those points. First up, I'm going to introduce Greg Cook, who's an outreach worker with years of experience dealing with people who are homeless, who cannot access the shelter system, and also working with people who are accessing the shelter system and otherwise underhoused. He's also a steering committee member of the Shelter and Housing Justice Network. Welcome, Greg Cook.
This current situation for people without housing is catastrophic. It's a crime that this building behind me sits empty. Yesterday, while receiving and distributing donations, survival gear, food, I checked in with a young man I know well. He lives in the valley in a tent. He's had no access to food for days. If he wanted to panhandle, he couldn't. No one's around. If he even was given money, he couldn't spend it because most places aren't taking cash. He's had no access to bathrooms for days, as most drop-ins have closed. No place to wash his hands. He's terrified, starving. I was able to get him some food for yesterday, but frankly, what are his options? And he is in a relatively lucky situation for many people that don't have housing. He's young, in relatively good physical condition. What about seniors into the shelter system? How are they to survive? Or people with asthma living in tents. I walked by a women's shelter this morning, and there are women asleep, crammed out front on the sidewalk as it rained. This community center here sits empty. Why? At any time, everyone should have at least a room, especially now with COVID-19 spreading like wildfire. The city needs to act. Other countries, other municipal governments are taking drastic actions. They're commandeering hotel rooms. In the UK, we understand that they're planning on opening up 45,000. There's tens of thousands of hotel rooms that sit empty in Toronto. We must take them and move people into them immediately. John Tory, you need to do this immediately. The Chelsea Hotel, for example, has 700 hotel rooms. There are kitchens that can feed thousands. This is an emergency. We need to act immediately. Meanwhile, the city hasn't even replaced 115 out of the cold cots that had to close to make sure that the senior volunteers don't get COVID-19. To what Yogi also said around people, workers like me are having to make impossible decisions around, do we distribute food to people that are starving and put ourselves, our families, the places where we live at risk, and put, frankly, even more importantly, the people who are immune compromised, people without housing, people who are often already have coughs at risk, or do we make sure that they have food so that they can survive? People who are starving are going to be in an even, I'm not a medical expert, but are even a worse situation if they get COVID-19. So I implore all three levels of government, you have to act. Commandeer hotel rooms, double social assistance checks, please.
Thank you, Greg. Next up, I'm going to invite Ritika Goel, who is a family physician who has substantive experience working with people who are homeless in this city. Welcome, Ritika.
This week, I've been terrified, as has everybody, for their family, but I've also been especially terrified for my patients. How are people who are experiencing homelessness supposed to engage in social distancing? As a physician working with people experiencing homelessness, people living in poverty, people who use drugs, and people with severe mental illness, all I've heard about this week is how people feel society does not care about them. We have created a situation where the people who are at highest risk to transmit COVID-19 are together, unable to socially distance, and then unable to self-isolate if they have symptoms. We have created a situation where there are no mental health supports available for people, drop-ins are closed, food banks are closed. We're facing an unprecedented crisis, and this is showing society what people have known for a long time, what communities have known for a long time, what people experiencing homelessness and people who use drugs have known for a long time, which is that we are in a crisis, and we've been for a long time. If we had proper affordable housing, we would not be here today. If we paid a living wage, we would not be here today. And if we had proper social assistance rates, we would not be here today. So we need to use creative solutions. We've seen the governments thus far move mountains, and we have to do this now for people experiencing homelessness and people living in severe poverty, people with severe mental illness, and people who use drugs. We need to drastically increase shelter spaces and open drop-in spaces for people to have the supports they need. We need to drastically increase social assistance rates to compensate for the lack of food banks, for the lack of income supports that people normally can access. We need to make sure that people who are uninsured can access the health care they need on the point of service. And we need to ensure access to harm reduction services, overdose prevention sites, and supervised consumption sites that must be safe for the workers, they must be safe for the people using them. This is the time for action. It's a time where the people who've been forgotten by our society now matter because their health affects our health. So it's the time to act, and we call on all of our governments to do this promptly.
Thank you, Ritika. Next up, I'm going to introduce Franky Morris, who's an overdose prevention site worker who works in the downtown east of the city.
Good morning. This pandemic hit our community in the middle of an overdose crisis and a dangerous shortage of shelter and housing. Prior to COVID-19, our community was struggling to respond to the deadly impact of a toxic drug supply. Resources were already stretched thin, and thousands of lives had already been lost to preventable overdoses. Governments were not stepping up to deliver the resources needed to save lives. Supervised consumption sites and overdose prevention sites were cut, shelters were full, community calls for increased harm reduction services and a safer drug supply were ignored, and the criminalization of drugs and drug users continued. In a matter of days, COVID-19 has thrown our community into further chaos. Not only are people who use drugs at high risk of experiencing severe illness related to COVID-19, but efforts to prevent transmission, including the closure of social services, supervised consumption service reductions, and isolation during quarantine, may lead to an increased risk of overdose death. The number of 911 calls for reported overdoses skyrocketed just before the pandemic hit our community. With many social service closures and resources stretched thin, people who use drugs are all the more vulnerable. What also frightens our community is that people seem more reluctant to use rescue breathing when responding to street-level overdoses for fear of contracting the virus. We worry that there will be more fatal overdoses as a result. Community members have also been reporting increased barriers to accessing methadone, Suboxone, and safer supply as they balance public health recommendations to socially distance with imposed daily dispense rules. Our community cannot handle more preventable deaths. Our workers cannot handle responding to another crisis with limited resources. We need resources to support people who use drugs throughout this pandemic. The government must expand access to safer opioid prescribing programs and overdose prevention sites and ensure needed personal protective equipment is available. Harm reduction services, witness injection, and safer opioid and stimulant prescribing must be available at all quarantined facilities. The government must work with people who use drugs to develop strategies to respond to evolving needs during this pandemic. To save lives, we must ultimately address the root cause of overdose death, the poison drug supply. Decriminalization and a regulated drug supply are urgently needed.
And finally, I'm going to call on Gaetan Heroux. He's a community worker who has worked with homeless people in the neighborhood for over 30 years.
In case I forget, if there's one thing I want the media to pass forward to Mayor Tory, city politicians, Doug Ford, and Justin Trudeau, is get our people out of these shelters. These are death traps. Everyone we talk to understands that. Because we are talking to someone. So I just want to say right at the beginning, because if anything comes out of this news conference, I want that message to come out. I, along with some of these other people, have worked down here for decades. Eric German, just behind you, was here in 1985 when Gina Chabert froze to death on the streets when we had no housing for single adults at the time. We organized and we mobilized and forced governments to create housing for single adults. Many of us were here at the beginning of 1996 when 3 men froze to death. Marcel Escampani, Eugene Upper, and others. And out of that, Mayor Hall was forced to open the Mosspark Armories, a result of community outrage that our people were dying on the streets. You have to get people out of these shelters by any means necessary. There are thousands of empty rooms in hotels right now that are not being used. Use them now. Put the people that you need to put in there now. I want to talk specifically about an area that people might not understand too well, and that's the drop-in centers. And I worked in a drop-in center for 10 years. This morning, Danielle and I went to Margaret's. We stood outside Margaret's. It was about 8:15. There were 7 to 8 people standing in the rain, waiting to get in, waiting for someone to come out. Because only one at a time go out in the rain. That is outrageous. We haven't solved that problem. As more and more shelters shut down services or make access services more difficult, whether it's the Good Shepherd or Scott Mission, where people used to be able to go in and get shelter and eat their meals, now they're giving meals outside.
Shame.
Outside, and they have to eat outside. The libraries are all shut down. Does not the city know that that's one of the prime places where people go, homeless people would go? If you went to the reference library on any given day, you could have 60 to 70 people in there. And they use it as shelter, but also the washrooms. If you go across the city today and I go, I need to eat, we'll have fast food, everything is shut down. You can't sit down. Their washrooms are shut down. So how do we resolve that? A place like this that's empty, open it up today. Whatever function you want to give in here, if it's a shelter, it's a shelter. If it's a drop-in, it's a drop-in. The Moss Park Armories sit empty. There's a history in the city of those armories being opened up for homeless people. Open them up. The Air Canada Centre is empty. The Toronto Convention Centre is empty. There are buildings at the CNE that were used last year for homeless that are sitting empty. How dare you tell us that you don't have any space, that you're scrambling to do this. You've known about this for a long time. Long time. We need centers where people can come in to access shelter, to get food, to access washroom so they can wash their hands. And then we can triage from there. Once people are in there, if we have motels or hotel rooms, then put them in there. If we have created shelters that are safe, not overcrowded, where people can meet the most basic things that they need to do to survive, things that the medical officer is telling us to do, like wash our hands, keep away from people, 2 feet away from people. We can do that. Why aren't we doing that? What is taking so long? So again, I want you, if the message I want to get out there is yes. Get our people out of there. I've watched in the last 32 years thousands of people die on the streets. Greg just told me about somebody that we worked with about a week ago who died. We've watched this and we've fought and we mobilized. In this climate, it's hard to do that because they don't want us to get together. But we will, in the end. If as our people die on the streets, if something happens in one of those shelters, they are accountable, all 3 levels of government. And to those people who are in the shelters, please, 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 call out to the media and tell them what's going on in there, because many of us don't have access to some of these services. We don't actually know what's going on in there. So I'll stop there.